Over 60? Never make these 10 blood test mistakes. They can change everything about your health. They tell you to fast, roll up your sleeve, and trust the results. But what if your blood test is lying to you? What if one small mistake you made before the blood draw is quietly leading to a misdiagnosis? One that could cost you your kidneys, your memory, or even your life. Seniors are especially vulnerable. Nearly half of senior blood tests show false results because of simple pre-test mistakes most doctors never warn about. This isn't fear. It's documented science. Everything you're about to hear is backed by peer-reviewed research from Harvard, Mayo Clinic, and leading medical journals. And wait until you hear mistake number 2. It can make a healthy heart look like heart failure on paper. Before we begin, 2 quick questions. When was your last blood test? And did you do anything different that morning? Coffee, exercise, skip meds? Drop your answer in the comments. We read and reply to everyone. Now, let's uncover the 10 biggest blood test mistakes seniors make. Starting with number 10. The 10 blood test mistakes. Number 10. Not drinking enough water before the test. Hydration is one of the most overlooked yet vital factors in accurate blood testing. Most seniors don't even think about it. They focus on fasting. They worry about medications. They forget about the simplest thing, water. But this oversight can completely distort your results. What happens when you're dehydrated? When seniors arrive at the lab dehydrated, their blood becomes more concentrated. This condition is called HEMOCONCENTRATION. Think of it like this. Imagine a glass of orange juice. If you remove half the water, the juice becomes thicker and more concentrated. The same thing happens with your blood. When you're dehydrated, your red blood cells, white blood cells, platelets, and electrolytes all appear higher than they actually are. A senior who simply forgot to drink water the morning of the test may end up with lab results that falsely suggest anemia, inflammation, kidney stress, blood disorders, none of which may actually exist. The research. A 2018 study from the American Journal of Clinical Nutrition revealed something startling. Patients who fasted without drinking water had hemoglobin levels that appeared up to 10% higher than those who drank just 2 cups of water 1 hour before testing. 10% higher from dehydration alone. In older adults, where hydration balance is already delicate due to age-related kidney changes, this mistake becomes even more dangerous. Here's a specific example that should concern every senior. Elevated BUN, blood urea nitrogen, is often a sign of kidney dysfunction. But dehydration alone can raise BUN levels enough to mimic stage 2 or stage 3 chronic kidney disease. That's a serious diagnosis. That leads to specialist referrals, additional testing, worry, stress, and sometimes unnecessary treatment. All because of inadequate water intake. The simple fix. The correction is both easy and essential. Seniors should drink at least 1 to 2 glasses of plain water approximately 1 hour before any fasting blood test, unless specifically told otherwise by their physician. Here's what most people don't understand. Water does not interfere with fasting parameters. Water contains no calories. It does not affect glucose levels. It does not affect lipid levels. In fact, most labs recommend staying hydrated because it ensures a smoother blood draw, creates clearer plasma separation, produces more accurate results. Dehydrated blood is not only misleading, it's also harder to draw and can clot in the collection tube, forcing a repeat test. The common misunderstanding. Some seniors avoid water out of fear it will break their fast. This is a complete misunderstanding. Fasting means no calories. Water has 0 calories. Drinking water actually improves test reliability across the board. One helpful tip many experienced nurses give older patients. Bring a small bottle of water to your appointment and finish it in the waiting area. That simple 10-minute habit could mean the difference between a false alarm and an accurate diagnosis. Number 9. Taking supplements on the morning of the test. Many seniors believe that taking their daily vitamins and supplements before a blood test is harmless. It's just vitamins, they think. It's natural. It can't interfere with anything. But this small, well-intentioned habit could throw off several critical markers, including iron, calcium, B12, and thyroid levels. The hidden interference. Most over-the-counter supplements contain ingredients that directly interfere with blood test results. Let me give you some specific examples. Vitamin C is widely taken for immune health. Seems harmless, right? Wrong. Vitamin C can artificially lower blood creatinine levels, which are used to assess kidney function. A 2020 study published in Clinical Laboratory Science found alarming results. Patients who took 1,000 milligrams of vitamin C within 6 hours of a blood test had creatinine readings that were 12 to 18% lower than their actual baseline. That's enough to completely miss early kidney disease in seniors. Your kidneys could be struggling, but your lab work looks normal, all because of a vitamin. Iron supplements are another major culprit. When taken close to the test, they can elevate serum iron and ferritin levels. This can falsely suggest iron overload or mask actual anemia that needs treatment. Biotin is found in many hair, skin, and nail supplements. It can interfere with thyroid-stimulating hormone, TSH, readings. This is especially dangerous for seniors being monitored for thyroid conditions. A false reading could lead to medication changes that aren't needed or missed adjustments that are. B12 in fish oil can also alter results in hormone panels, liver enzymes, and lipid profiles. The critical fix. The fix is simple but absolutely critical. Seniors should skip all supplements for 24 hours before a scheduled blood draw, unless specifically instructed otherwise by their doctor. If a supplement is medically necessary and truly cannot be skipped, the lab must be notified beforehand. The technician can mark the test as potentially influenced, and the doctor can interpret results accordingly. Many labs will include a note in the report or flag values for retesting if necessary. Best practice. The safest practice is to bring a complete list of all supplements, including brand names and dosages, and hand it directly to the phlebotomist before the draw begins. That small step could prevent a false alarm that leads to unnecessary scans, unnecessary medications, unnecessary specialist visits, unnecessary anxiety. Your supplements might be helping your health, but they shouldn't be sabotaging your lab work. Number 8. Drinking coffee or tea before a fasting test. Fasting means no food or drink, right? Not exactly. And this misunderstanding leads to one of the most common mistakes seniors make. Many seniors believe that coffee or tea is perfectly fine during fasting because these drinks contain no calories or only trace amounts. It's just black coffee, they reason. It's basically water. But this assumption is one of the most misleading beliefs in senior health. The caffeine effect. Drinking coffee or tea, even black, can affect several important biomarkers and potentially skew your test results in ways that lead to misdiagnosis. Here's what happens inside your body. Caffeine stimulates your adrenal glands. These glands release stress hormones like cortisol and adrenaline. These hormones raise your blood sugar and stress levels temporarily. But temporarily includes the moment your blood is drawn. The research. A 2022 meta-analysis published in Nutritional Biochemistry produced concerning findings. Researchers found that consuming just 100 milligrams of caffeine, about 1 cup of coffee, within 60 minutes of a blood draw raised fasting glucose by an average of 8 to 10 milligrams per deciliter in older adults. That might not sound like much, but in seniors who are borderline diabetic, that small increase could tip them into a false diagnosis of prediabetes or even type 2 diabetes. Imagine being told you have diabetes and starting medications, changing your diet, worrying about your future when you were never actually diabetic. The coffee did it. Beyond coffee, green tea is often considered a health drink because of its antioxidant content. But green tea mildly suppresses platelet function. This means clotting tests or platelet counts may come back slightly altered if tea is consumed before testing. Even decaf beverages can influence results. The decaffeination process does not eliminate all bioactive compounds. Your body still reacts to what remains. The cream and sugar problem. Seniors who sip coffee with sweeteners or creamers face an even higher risk of skewed results. The body reacts to both sugar and dairy during digestion, and the impact on insulin and glucose can be dramatic. One study in clinical chemistry found that seniors who added just 1 teaspoon of cream to their morning coffee had insulin levels that were 28% higher compared to those who drank water only. 28% higher insulin from 1 teaspoon of cream. The correct approach: avoid all drinks other than plain water for at least 8 to 12 hours before a fasting blood test. Some labs recommend even longer fasting times for lipid panels, the tests that measure cholesterol and triglycerides. These values are especially sensitive to anything consumed during the fast. If you're unsure whether your morning routine might interfere with results, ask your doctor or the lab for exact pre-test instructions. Remember, fasting is not about starving. It's about precision. We're now moving into the more serious mistakes, the ones that can lead to major medical decisions based on faulty data. Mistake number 7 involves something most seniors do with the best intentions, but often backfires dramatically. Number 7. Skipping medications without doctor approval. Many seniors get nervous before a blood test. They wonder, should I take my medications this morning, or will they mess up my results? Out of caution, they decide to skip their regular medications. They think they're being careful. They think they're helping. But while that instinct comes from a good place, it often leads to more harm than good. The problem with skipping: certain medications should absolutely be taken as prescribed, even on the morning of a test. When a senior suddenly stops their blood pressure medicine, their diabetes medication, or their beta blocker without clear instructions, something dangerous happens. The blood test can show extreme spikes or drops that do not reflect their true health condition. For example, skipping a morning dose of metformin, a common medication for type 2 diabetes, can lead to elevated fasting glucose levels. This falsely suggests poor glycemic control when the medication was actually working perfectly. The research: a 2021 observational study published in the Journal of General Internal Medicine revealed something concerning. 1 in 5 seniors who skipped regular medications before a lab test had at least one value on their panel flagged as abnormal. But here's the key detail: the abnormality was due to withdrawal effects, not actual disease progression. Blood pressure readings, sodium levels, and even liver enzymes can shift dramatically when medications are suddenly stopped. This is especially true for those on diuretics, antihypertensives, heart rhythm medications. Abrupt withdrawal can cause electrolyte imbalances or even hypertensive episodes that trigger unnecessary imaging, referrals, or emergency interventions. The right approach: always ask your doctor ahead of time which medications you should take before a test. Some blood tests require pausing certain drugs. Statins may need to be stopped before lipid panels. Anticoagulants may need to be paused before clotting tests. But that decision must be guided by a physician, not made independently out of anxiety. In general, medications used for daily maintenance should not be skipped unless the provider gives direct, specific, preferably written instructions. Best practice: bring a written list of all current medications to the blood draw. Notify the technician of which ones were taken and when. Remember, the purpose of the blood test is to see how your body responds while on your usual regimen, not while you're in an artificial off-medication state. Your labs should reflect your real life, not a temporary exception. Number 6. Exercising before the test. Some seniors start their day with light stretching or a short walk. Others push harder with early morning cardio or strength training. While exercise is an excellent habit overall, doing it right before a blood test can distort your results more than you might imagine. Even a brisk walk can temporarily change your body's internal chemistry in ways that make your lab report completely misleading. What exercise does to your blood? During physical activity, your body releases stress hormones like cortisol and epinephrine. These chemicals raise blood sugar, increase inflammation markers, alter electrolyte balance, affect muscle enzymes. These changes are temporary. They normalize within hours. But if blood is drawn shortly after exercise, those temporary changes get captured as your baseline. A senior could appear pre-diabetic or inflamed when they're actually perfectly healthy. The research: A 2019 study in the European Journal of Applied Physiology produced striking findings. Adults over 60 who walked at moderate intensity for just 30 minutes before a fasting test showed glucose levels 12 to 20 milligrams per deciliter higher than baseline. C-reactive protein, inflammation marker, elevated by up to 40%. That's enough to trigger a false diagnosis. Exercise also causes dehydration, especially in older adults who sweat more but drink less. That dehydration can lead to higher readings of blood urea nitrogen, BUN, sodium, creatinine, all of which are used to assess kidney and liver function. A real case. In one well-documented case, a senior who performed light resistance training the morning of a test was mistakenly suspected of having a liver disorder. The elevated enzymes on his lab work triggered concern, follow-up testing, and specialist referrals. It was all exercise-induced. His liver was perfectly fine. The workout created a false alarm. The simple solution: avoid any form of exercise, even light, for at least 12 hours before a blood test, unless otherwise instructed. If a stress test or exercise-related hormone check is part of the exam, that's different. But for routine blood work, rest is your best tool. Instead of walking or doing housework, spend the hours before your test in calm, hydrated stillness. This gives your body time to return to a metabolic baseline, so the results actually reflect your usual health, not a post-exercise spike. If you must move around, tell the technician exactly what you did so the data can be interpreted correctly. Number 5, fasting too long. We've all heard the rule: fast for 8 to 12 hours before your blood test. But what happens when you take it too far? Many seniors believe that fasting longer is safer or more accurate. Some avoid food for 14, 15, even 16 hours before their test out of fear they'll break the fast too soon. But overfasting is a dangerous and overlooked mistake that can distort multiple blood markers and leave seniors feeling weak, dizzy, or even at risk of fainting during the draw. What overfasting does: as we age, the body's ability to regulate blood sugar and hydration weakens. When you fast too long, your liver releases extra glucose into the blood as a survival response. It's your body's emergency backup system kicking in. This means seniors who fast for 14 hours or more often show elevated glucose levels, despite not eating at all. Ironically, fasting too long can make it look like your blood sugar is out of control. The research. A 2020 study in the Journal of Gerontology, Medical Sciences found concerning results. Seniors who fasted for more than 13 hours had fasting glucose levels that were 22% higher on average than those who followed the standard 8 to 10-hour window. Overfasting also affects your lipid panel. While fasting is important for accurate triglyceride levels, extended fasting can lower HDL, the good cholesterol, raise LDL, the bad cholesterol, in ways that don't reflect your usual state. A 2021 clinical trial found that older adults who fasted for 16 hours before testing had LDL readings that were 10 to 15% higher than when they fasted for 10 hours. That artificial elevation could lead to unnecessary prescription of statins or dietary interventions that aren't actually needed. The physical danger. Beyond distorted lab values, overfasting puts your physical safety at risk. Seniors who go without food for too long are more prone to lightheadedness, falls, fainting during or after the blood draw. This risk increases if you're on medications for blood pressure or diabetes. The empowering fix. Stick to the recommended fasting window. No more, no less. For most standard panels, that means 8 to 12 hours. If your appointment is at 8 a.m., stop eating around 8 p.m. the night before. Water is allowed and encouraged. If you're unsure how long you fasted, tell the lab technician so they can mark your test accordingly. Some labs adjust their analysis based on exact fasting duration. Fasting isn't about deprivation. It's about precision. We're now entering the top 4 mistakes. These are the ones that can lead to serious medical consequences: unnecessary treatments, misdiagnoses, and decisions that affect your health for years. Pay very close attention. Number 4. not telling the lab about recent illness or infection. Many seniors believe that if they're no longer coughing or running a fever, their recent illness is irrelevant to a blood test. I'm feeling better now, they think. Why bring it up? But that belief can lead to major misinterpretations of your lab results. The lingering effects. Even after symptoms disappear, your body takes time to return to its normal state. Your immune system doesn't have an off switch. It winds down gradually. A recent cold, flu, or urinary tract infection can leave behind elevated white blood cells, high C-reactive protein, abnormal liver enzymes. These elevations can persist for days or even weeks after you feel recovered. If you walk into a blood test without disclosing your recent sickness, your doctor may interpret these elevated markers as signs of a new problem, not a lingering recovery. The research. A 2019 study in the Annals of Internal Medicine found significant residual effects. Seniors who had recovered from minor viral infections showed 30% higher white blood cell counts, up to 40% higher inflammation markers, compared to their baseline, even after symptoms had resolved for more than 5 days. The danger is that these lab abnormalities can trigger unnecessary specialist referrals, imaging studies you don't need, antibiotic prescriptions for conditions that don't exist. A real case. In one documented case, a senior woman who had recently recovered from sinus infection went for routine labs. Her elevated liver enzymes were flagged. She was referred to a hepatologist, liver specialist. She was scheduled for an abdominal ultrasound. The results? Completely normal. Her liver was fine. The elevation was from her recent infection. But the emotional and financial cost was high and completely avoidable with simple disclosure. The solution. Always inform both the lab technician and your doctor if you've recently been sick, even if you feel mostly recovered. It's especially important to mention if you've taken antibiotics, antivirals, over-the-counter medications like ibuprofen or acetaminophen. These drugs can elevate liver enzymes on their own. Remember, your immune system doesn't reset instantly. Your labs reflect your biology over the last 24 to 72 hours, not just the moment the needle touches your vein. Number 3, getting tested at the wrong time of day. Not all blood tests are created equal. Some must be taken at a specific time of day to be accurate. Yet many seniors arrive at the lab whenever it's convenient, or simply whenever they wake up. This small scheduling oversight can lead to massive distortions in results. The circadian factor. Many substances in your blood follow a circadian rhythm. They rise and fall predictably during the day. Cortisol is highest in the morning and drops throughout the day. Testosterone peaks in early morning and declines by afternoon. TSH, thyroid stimulating hormone, varies significantly based on time of collection. The research. A 2022 study in the British Journal of Endocrinology revealed dramatic variations. Cortisol levels measured at 4 p.m. were 60% lower on average than those measured at 8 a.m. in healthy seniors. That's a massive difference. If your doctor ordered a morning cortisol test to evaluate adrenal function, and you show up in the afternoon, the results could wrongly suggest adrenal fatigue, adrenal insufficiency, conditions that require treatment, when your adrenal glands are actually perfectly healthy. Lipid panel timing. Lipid panels are also time-sensitive. Triglycerides peak in the late afternoon and are lowest in early morning after fasting. Blood sugar and insulin levels are most stable in the early hours. If you take your test too late, after stress, food, or irregular routines, the numbers may appear worse than they actually are. Medication monitoring. The same timing principles apply to tests that measure drug levels, like warfarin, digoxin, or seizure medications. These drugs have a half-life, the time it takes for the drug level to drop by half. If the test is taken too early or too late after your dose, the reading could fall outside the therapeutic range, even if the medication is working perfectly. This could lead to unnecessary dosage changes. The right approach. Always follow the exact timing instructions given by your doctor or lab. If no specific time is mentioned, it's safest to schedule blood tests for first thing in the morning, ideally between 7 o'clock and 9 a.m. That timing matches the standard reference ranges used by most laboratories. If you cannot make a morning appointment, call ahead to confirm whether your specific test allows for afternoon collection. And always note the time of your last medication dose, the time of your last meal, on the form or verbally to the technician. Time matters more than most people realize. Number 2, not disclosing over-the-counter medications or herbal products. Seniors often underestimate the power of non-prescription substances. Whether it's aspirin, ibuprofen, allergy pills, cold medicine, herbal teas, natural supplements. Many of these compounds have profound impacts on your blood chemistry. Yet very few seniors mention them during blood draws. Either they forget or they believe only prescription medications matter. This oversight can be catastrophic. The hidden dangers. Ibuprofen and aspirin are both classified as NSAIDs. They affect kidney function and liver enzymes. Taken the night before a blood test, they can raise creatinine levels, lower platelet counts, mimic early kidney stress. A 2021 article in the American Journal of Therapeutics found that 33% of seniors who took ibuprofen within 24 hours of blood work had creatinine levels elevated by at least 10%. That's enough to trigger concern about kidney disease. Herbal products. Herbal products can be even more deceptive. Ginseng, ginkgo, echinacea, turmeric, and St. John's wort can all alter hormone levels, liver enzymes, blood pressure readings. Some teas, especially those marketed for detox or relaxation, contain natural diuretics that raise BUN and sodium levels. Supplements like garlic, fish oil, and vitamin E thin the blood and may skew clotting factor tests. A real case. One elderly man taking ginkgo biloba for memory support showed dangerously low clotting ability on his routine labs. His doctors were alarmed. He wasn't on any prescription blood thinners. It turned out ginkgo, a natural vasodilator, was the cause. He nearly received treatment for a condition he didn't have. The simple fix: awareness and full disclosure. Seniors must tell their doctor and the lab about every substance taken within the past 72 hours, including herbal teas, ointments and topical creams, over-the-counter pills, supplements of any kind. Bring the bottles with you if necessary. Labs do not guess what's in your system. They assume you've shared everything relevant. What seems harmless to you could be the very reason your lab work looks strange. And now we arrive at the number 1 mistake. This is the mother of all blood test errors. It's one that even many healthcare providers overlook. And it could be changing how you understand your health in ways you never imagined. Number 1. Assuming all labs use the same reference ranges. This is the mistake that affects everything. Different laboratories use different equipment, different methodologies, different reference ranges. This means a normal result at one lab might be flagged as abnormal at another, and vice versa. Your diagnosis could literally depend on which lab drew your blood. The shocking research. A comprehensive analysis published in the Archives of Pathology found that reference ranges for common tests could vary by up to 40% between major laboratory chains. 40%. That's not a small discrepancy. That's a massive gap that could change your diagnosis entirely. The thyroid example. Take thyroid tests as an example. One major lab might define normal TSH as 0.5 to 4.5. Another lab uses 0.4 to 4.0. That seemingly small difference means thousands of patients could be diagnosed as hypothyroid at one lab, declared perfectly normal at another. A study tracking 1,200 patients who had tests at multiple labs found that 23% received conflicting diagnoses based solely on reference range differences. Nearly 1 in 4 patients got different answers, depending on where they went beyond reference ranges. The problem extends beyond simple numerical variations. Different labs use different testing methodologies that can produce systematically different results. Hemoglobin A1C, crucial for diabetes management, can vary by 0.5 percentage points between methods. That's enough to change someone's diagnosis from controlled to uncontrolled diabetes. The insurance problem. Insurance changes often force patients to switch labs, creating a tracking nightmare. Your cholesterol might appear to spike dramatically when it's actually stable, just measured differently. One documented case involved a patient whose LDL cholesterol increased by 30 milligrams per deciliter after switching labs. This triggered an unnecessary medication change. Repeat testing at the original lab showed no change. The increase was purely methodological, not medical. The solution. This mistake requires vigilance and communication. Always note which laboratory performed your tests. When comparing results over time, try to use the same lab for consistency. If you must switch labs, inform your doctor. Request a baseline test at the new facility. Expect some variation in numbers. Keep your own records, including lab name, reference ranges used, methodology when available. Ask your doctor to consider trends rather than absolute values, especially when results come from different sources. Most importantly, question any dramatic changes that coincide with switching laboratories. Your health decisions should be based on accurate comparisons, not artificial variations created by different testing standards. You now know the 10 biggest blood test mistakes seniors make, and how to avoid every single one. Let me recap them quickly. Not drinking enough water. Stay hydrated for accurate results. Taking supplements. Skip them 24 hours before testing. Drinking coffee or tea. Stick to plain water only. Skipping medications without approval. Always ask your doctor first. Exercising before the test. Rest for 12 hours beforehand. Fasting too long. Stick to 8 to 12 hours, no more. Not disclosing recent illness. Always mention recent sickness. Testing at the wrong time. Schedule for early morning when possible. Not disclosing OTC medications and herbs. Tell them everything. Assuming all labs are the same. Use consistent labs and track variations. Each of these mistakes is preventable, and preventing them could mean the difference between an accurate diagnosis and a false one, necessary treatment and unnecessary medication, peace of mind and months of worry. Your blood test should reveal the truth about your health, not misleading data created by simple, avoidable errors. Now, I want to hear from you. Have you ever gotten confusing or scary blood test results that didn't match how you were actually feeling? Which of these 10 mistakes surprised you the most? Do you think you've accidentally made any of them before? Share your experiences and opinions in the comments below. We read every comment and respond personally with customized advice. Your story might help someone else avoid the same mistake. If this video opened your eyes to something you didn't know, if it could help you or someone you love get more accurate blood tests in the future, share it. Send it to a spouse, a parent, a friend. Because accurate diagnosis is the foundation of good health, and everyone deserves to know the truth about their blood work. Thanks for watching, and I'll see you in the next video.